Good morning, everyone. I'd like to call to order our Behavioral Health Subcommittee. Madam Clerk, would you mind taking the roll?
Chair Brayback.
Here.
Representatives Arbeck.
Here.
Pahutsky.
Here.
Glanville.
Present.
Edwards. McDonald. Rangans.
Here.
Schmaltz.
Here.
Hoadley.
Here.
St. Germain.
Here.
Thompson.
Present.
Madam Chair, you have 9 members present. You do have a quorum.
Thank you so much. I really appreciate it. Representative Glanville moves to adopt the minutes from the September 7th meeting without objection. The minutes are adopted. And now the committee will go at ease.
The House Subcommittee on Behavioral Health will come to order. We will now hear testimony on House Bill 4081 by Chair Brayback.
Thanks so much, Chair Arbett. I appreciate it. Thank you, members of the committee, for allowing me to testify this morning. The bill on school counselors is really near and dear to my heart. And this is one of the first bills that I introduced last term at the start of my journey as a legislator. And it comes from a place of lived experience. So our school counselors are vital to the fabric of our school ecosystem. And they assist students with a number of things, particularly around their post-secondary education goals, helping them prepare for work and life in the workforce, any career and technical education that they need. And they help do that, and they are really the frontline members for our students. They can work on academic courses, they can address issues around peer pressure, bullying, and kind of the beginnings of any sort of issues around mental health illnesses. One of the things that I know, and I'm sorry now my glasses are fogging up because of my mask, having worked in a large public school, I got to work in a public school of about 3,000 students, and I was the social worker for our general ed population and worked seamlessly with our school counselors. And the way that this works logistically is our school counselors are really the first line for our students. That's who they have generally the most contact with, because that's who they're working with on scheduling, and that's really their point of contact. And I can tell you that I had when I worked in the schools, had many school counselors refer students to me who were having some mental health care issues and needed more support. And I can tell you also that in visiting one of our local high schools in my district, I was able to meet with students and with school counselors. This was just a couple of months ago. And the students talked about how vital it was to have their school counselors in place, because their school counselors were the ones who actually then not only helped them around academics and kind of looking to their future, making future decisions, but also, at least in one case, referred them to the student health center so that they could get more support around their mental health care needs. So logistically, our school counselors are just an integral part of the fabric that we weave in terms of support for all of our students. So in terms of the numbers, we can do better here in Michigan. Unfortunately, we're at the bottom in terms of the ratio. It has varied in recent years. The most recent number, and if this is incorrect, our colleagues from the School Counselors Association will fix this. But right now, we're at around 1 in 615. In my reading of where we should be is about 1 in 250. And I would say that I would love it if that ratio was even lower. But what we know about smaller student to counselor ratios is that leads to better outcomes for students, And it also helps our counselors manage their caseload in a much more meaningful way. You know, there aren't these just quick sessions with students, but they're able to actually get to know their students, and they're actually able to help them in a much more comprehensive way when they have more time. So part of what we're just hoping to do is to align what we have here in our state with the American School Counselor Association at every, one counselor for every 250 students, and hoping again to decrease that burden that we've placed on our school counselors and other school staff, and just helping to make our school environments that much healthier. Part of what we need to continue to work on, the crux of the bill and getting the policy of the bill is really sound. We know where we need to get. What we need to work on yet is how to fund this model. Now, a lot of our schools, there are schools that are at this level. I actually heard a story of there was an administrator at a school who, when hearing this at first, thought, "Oh, we can't possibly do this," and then when I actually looked at the numbers, they were already doing it. And so I think part of it is when people sometimes hear this, they think, "Oh no, we can't possibly do this." But I think it is achievable. I already know districts that are doing it. I've spoken with them, but we need to get everyone to that level. And so we need to figure out the funding mechanisms by which to get there and to help schools manage that and get there. And so we have some work to do. I just want to let you all know we have work to do, but I wanted to bring this before you so we can get this conversation started publicly. And as we continue that work, I will continue to update you all, but I'm hoping that when we are ready to go, you all will be in a place to support this legislation. Thank you, Mr. Chair.
Thank you, Madam Chair. Rep. Schmaltz?
Yes, thank you, Chair, and thank you, Representative. This sounds great on the surface.
Yep.
It sounds like a good policy. We want every child taken care of, but I just don't see how it's feasible. I've talked to a lot of my superintendents, and they would love to do this, but their hands are tied. We can't find teachers right now. We can't even find bus drivers. We can't find nurses. We can't find resource officers. How are they ever going to find counselors to do this? One of my superintendents said that it would cost him $600,000 because he would have to hire 5 more school counselors. And it's just, to them, it's just not feasible. Another one said they would have to fire a nurse to be able to hire a counselor. This is just not the direction that we want to go into. So I see a problem with that. Another superintendent was worried that school districts would get into bidding wars over getting this school counselor from this district because there aren't enough counselors.
Sure.
So how do we deal with it?
Yeah, so as we've talked about many times in this setting, our issues with mental health care, the mental health care system at large, are multi-pronged. So I know that we're working on workforce issues. So I hope that that's part of your response back to your superintendent.
But this is a mandate.
Right, but we have to have the workforce, right? So we need to work on that issue, which we are. So I think, number one, being able to work on the workforce issues, which we're doing, and we're continuing to do, whether that's getting more social, we're going to be, Representative Edwards and I are going to be dropping a bill on the MSW licensure, which we heard testimony about earlier this year. That's going to be dropping. We have bills around appropriations around support for supervision. And we have appropriations around getting more MSWs into the field, which we know has made a marked difference, particularly in our neighboring state of Illinois. And so there are many ways that we are working on the workforce issue itself, which is dovetailed directly into this.
So maybe there wouldn't be a mandate unless we had the workers.
Well, I think that we need to kind of work on parallel pathing this and making sure, because part of what, when we are able to both have the workforce but also push forward the policy, I would also want to understand, and like I mentioned before, we have to work on the funding mechanisms. That's something that when I was working on this last year, I got to work with Representative Ben Frederick. And he and I were working a lot on okay, how could we do this? What does it look like? There was a model in Colorado that we were looking at, that I've continued to look at and see the feasibility of it. So we know that there are issues, or I know that there are issues that we need to address, but I also think that we need to continue to try and tackle them and not just stop.
And is there anything in there that would, what would be the penalty for a district who didn't adhere to this?
Oh, that's not, we didn't put any, there wasn't a punitive measure in the bill.
Okay, all right, thank you.
Yeah, of course.
Representative St. Germain.
Good morning, and thank you, Chair. You had mentioned, having a frontline member, and I agree with that. But I feel like we're kind of sort of missing the mark. We took funding out of the budget that really should have been allocated towards school resource officers, and school resource officers aren't just there to protect the kids for, shootings and whatnot, but they are that frontline member, and they are that mentor and counselor. They're that person that can help diagnose with mental illness or, things that are happening at home, and also refer children to the mental health care issues. Shouldn't we have more options, such as an SRO or a school-based therapist, maybe? What's your thoughts on that?
So those are two different issues to me. I mean, I'm hoping that a school resource officer isn't doing any diagnosing. That's not their responsibility. That's a mental health care's person's responsibility.
Yeah, and I don't mean that, just,
okay.
Referring, being that
Yeah,
frontline member.
and that's
Yeah.
great. That again, these issues are we have to be able to look at these issues multi-pronged. This isn't an either or, And so yes, but that's not what this bill is about. Right? Like this bill is about being able to provide the web of services that we need for our students, and this is one of the places that we know that Michigan is falling woefully behind.
Thank you.
Yeah, of course.
Representative Glanville.
Yes, thank you. And thank you for bringing this issue forward. I know it's incredibly important. My sister-in-law is a school social worker. She's towards the end of her career, and she is absolutely burned out.
Yeah.
As are many. The issues that our kids face these days are immense. There's immense pressure to perform on high-stakes tests. There's immense pressure to, decide what you're going to do with the rest of your life and go to college, when you're 16. They are recovering from mental trauma due to the pandemic that we as adults really just don't understand in terms of, I heard a lot of people saying, oh, we'll just go back to school as usual, and we forgot our kids don't know what usual is because they haven't had the same experience. Like, we know what school is, but they don't. They have a completely different perspective on that. And so I think, when we talk about the role of a school psychologist, we're talking about helping all of our kids to be successful in all of the areas, bless you, of education, and to give their families the support as well. And so I appreciate this, and I also appreciate our colleagues' questions about the funding. I wonder if you might be able to speak at all to the SMART grants that we enacted last year. Is that something we need more information on?
So I think that's something that's being rolled out, and we'll be able to, again, I think there are going to be many facets that we can try and pull from, but I think that in my mind at least, I want to focus outside of that to be able to figure out the funding solution for this. I think that those help, certainly, but I don't know the scope of how much that would cover. And so I want to continue to tackle that issue.
Okay, thank you.
Yeah,
And again,
absolutely.
thank you for bringing this forward.
Yeah, absolutely.
I have a question.
Yeah,
and
ask away.
And then, I think this is such an important issue, and some questions have been raised about is this feasible? Do we have the workforce? Do we have the funding? Whatever. But I was wondering if you could talk about just at a fundamental level, what does it mean when a child isn't getting the service or the oversight that they need, right? I just think about I think the state's number one duty, right? Duty to protect. And in so many different towns, cities, homes across the state where you don't have the resources or the access to a mental health professional to be able to provide for your kid, or that was never something that, and when you grew up as a parent, right, that was never something that was provided to you. And so it's just not ingrained. It's not done. And if the school isn't providing it, meeting people where they are with those resources, what's the result for kids, for families, for their trajectory, and for our state as a whole?
Sure. So there are very practical ways that this impacts our kids. I think about, again, our school counselors are the ones who have some of the most contact with our adolescents in high school. And that's who they're working on their schedule. That's who they know who to go to if there's a problem that's happening, in school, whether it's bullying or something's happening at home. That's their point of contact. And in talking to the school counselors that I got to talk with just a little bit ago at the high school that I visited, they talked about kind of their caseloads right now. And the school that I went to, their caseloads were good. And so they said that they felt like they were able to actually engage with their students. And if they saw some flags come up, then they also have a school-based health center in this high school, like I mentioned. And so they're able to then transition and literally walk students down so that those students can get the services that they need, like you said, where they are. And so I think that, for so many students, that allows them to have access to care that they may or may not otherwise have. But I know from talking to students about it, they have said that that service, like that their counselor knowing them so well and being able to, they trusted their counselor, right? So when their counselor said, hey, I think maybe this might be an opportunity for you to get some more support, they trusted that because that relationship was built with their counselor. And then, the student said to me that when they were then worked with the mental health care practitioner in their school, that was a lifeline for them. And so we know at least the students that I've talked with, the immense impact that has had on their life, not only their high school career, but on grounding them to be able to tee them up for what they talk about with their school counselor for future endeavors.
Thank you. Thank you, Chair, and thank you, Representative, again. Taking care of our kids is so important, and we've talked about this many times. Especially nowadays, our young people need so much help, and we need to have people there to help them. I just worry about, of course, not having the counselors, the mandate on school districts, the funding, and also, I believe 47 states don't meet this requirement, according to the ACLU. So I just worry about all that. Thanks.
Thanks again.
The committee will go at ease.
Committee is back at ease. We are going to now, we'll come to order. We're now going to hear continued testimony on the bill, and here we have Samantha Zill and Rebecca Ward, both from the Michigan School Counselor Association. Welcome. We're happy you're here today.
Hello. Thank you for having us today. We are so excited to continue conversation about Bill 4081. My name is Rebecca Ward. I am a counselor at Lincoln Middle School in Ypsilanti, Michigan. We are not part of the Ypsilanti Community Schools District. We are part of Lincoln Consolidated. Representative Brayback, you were a wonderful representative before everything got redistricted. Thank you. This is my, and Representative Miller is too. I am in my 20th year in education. I taught at our high school, chemistry, biology, forensic science, and all the things for 13 years before moving into school counseling 7 years ago at our middle school.
And I'm Sam Zill. This is my 11th year as a school counselor. I work for the Holt Public School District. I'm at the junior high. I'm the 7th grade counselor. I've been a part of the Lansing School District at Eastern High School. And before that, I was over in Warren at Van Dyke Public Schools. So I've kind of gotten to work in a bunch of different areas with different demographics of students.
First, we wanted to kind of take you through a typical day as a school counselor. I know many of you just think of high school counselors, but there are those of us in middle schools and junior highs, and sadly not enough in the elementaries, but we are a pre-K to 12th grade profession. So I kind of charted out my day yesterday, and there is no true typical day in the life of a school counselor, but this was my day yesterday. I'm in a building with 2 school counselors. Our caseload is alphabetized, so I have A through L. We have about 305 a person right now. Our building is 6 through 8. Yesterday I started at 7 a.m., started by scheduling 10 new students across the different grade levels and getting computers charged for NWA testing that started that day. I moved to college and career lesson number 1, first hour, which started at 8:15, completed it just in time to be met at the door by a 6th grade teacher looking for me to help input students for testing that weren't in the computers. Headed back to do that and met a student in the calming room. We do have one of those in our counseling office. That student was anxious because dad is getting out of prison this weekend and worried he will come and try to take him back. Before heading to second hour for another lesson, I called 2 of the parents of the students to start tomorrow and answered their questions, tried to get them set up with bus transportation. I still have 8 more to call before the end of the day. Going back to teach lessons, as I leave, a student stops me in the hallway to let me know they want to fight a kid at lunch. I get them to the office and then run to the class to teach, hoping that administration will handle that while I'm in the classroom. Another lesson goes by and more phone calls to parents. Now 7 are good to start tomorrow. There's 3 left. We have to get them in before count day. Secretary is out, so I went and emptied the voicemail on her phone so we can get back to parents that are needing some answers from her. After my last lesson of the day, I counted 25 students with no computers out of 100 that I worked with. I have to put in tech tickets for each one of those before NWA testing starts for their grade level next week. Next, I had a meeting with one of our coordinators for some lessons that are coming up, then a consult with an outside therapist on a student, back to entering in students and troubleshooting more NWA stuff. I had a student who is a diabetic who was in high sugar. I needed to help treat them because the nurse was at a different building at that time. Helped that student get moving and drinking and feeling better just in time for there to be the fight in the hallway at 2:30. This was a different student, not the one from lunch. The bell rings at 2:57. I get to go do bus duty and head out at 3:15 to pick up my own children from elementary school, just in time to remember I actually hadn't gone to the bathroom since 7:30 that morning, and those 3 kids I still didn't get to, so hopefully they can start next week.
And so I just wanted to give a little overview of what a school counselor is, because I think there's a lot of misconception. I know, like, when I was in high school, it looked a lot different than the role of a school counselor does now. And so the idea is that we kind of provide a comprehensive approach to working with the student. So we are trained in helping kids with their college and career readiness. We help with academic support. We help them with social emotional learning. And the idea is that all of those things don't really just act as one by itself. They're all connected. So for example, if we're talking with a student who is failing their math class, maybe they're failing math because they're not good at math, but also they might be failing math because there are issues going on at home and math is their first hour class. And when they come in first thing in the morning, they're just kind of in their feelings, and concentrating on math is not taking priority. It might be that there's somebody in the classroom that is upsetting them. Maybe they had a breakup and that's affecting them. So we just like to look at how everything is connected so that we can fully support the student. And then we have that training in all of those areas. So then when we look at ratios, where this 250 to 1 came from is that is what the American School Counseling Association recommends from the research that has been done. That's what they found. That's where students really succeed and that they see differences. So we can share anecdotal evidence of how we see students succeeding when we're able to work with them more and they have contact with us, but there's also data that shows those things. So if you guys have the handouts, there's the one that is impact of school counselor to student ratios. And it just shows some of the ways that when a student has access to their school counselor, there are 250 students to one school counselor. A lot of things go up. So like SAT scores go up, graduation rates go up, student absenteeism goes down. And I know Representative Brayback talked about the Colorado School Counselor Corps Grant Program. So they have done a lot of research as well, and they're finding very similar outcomes. They also found that students began enrolling in more CTE courses when they are that 250 to 1 ratio, and the grades improved. Just basically everything good goes up, everything bad goes down. So in Michigan, we also have a handout that shows each state and what the average ratios are. And Michigan is currently at 615 students for every one school counselor. So it's not great. We are third worst in the country. I will say we used to be second worst, and I think that number was up in the 700s. So we are already making progress, and we would love to just continue to grow with this progress. One blind spot I think that there is, that Rebecca kind of brought up too, is when we think about school counselors, I think most of us, just the first thing that comes to mind is the idea of like a high school counselor. But elementary school counselors are so crucial. I've worked in 3 different districts. I have never had a district that has had an elementary school counselor. And when you have those positions, that makes a huge difference because those school counselors can start working with kids on building those academic skills at a young age so that they understand just how to stay organized, how to study for a test. They can start learning about colleges and careers so that they're not waiting until they get to high school to really start exploring what they want to do after they're done, after they graduate. And then they can start learning some of those social and emotional skills so that they understand when like an emotion comes up, they know what strategies work for them. So if they get angry, their go-to isn't like to punch their classmate in the face. And as a 7th grade counselor, we see that is their coping mechanism when they come in. So just kind of really building those skills. And then when they get to middle school and they get to high school, we can just continue to help them expand those skills. And it's really creating long-term success for the students.
I know this was brought up a few times, kind of the mental health side of what we see in our schools and not just the academic or career technical type of side. So just kind of anecdotally from my end, my first year at our building, we had 5 suicides, all in the same 8th grade class. None of them were connected to each other. None of them. We buried 5 babies that year. I didn't know any of them because I didn't have time to talk to any of them. So when that happened, that rocked our school. And ever since then, that's become a huge focus for us to get to know every kid in our building of over 700. And it's exhausting to try to do that. But that hasn't happened since then either. And I don't want to say it's just because of us, but it's because of programming we can put forth. It's because of connections we can make. And again, it's so time consuming and it takes time away from other things too that need to be done. But that was a really rude awakening into the world of school counseling that year. And we've said, and my assistant principal have said, we're not burying another one. So that's been our goal since then, working through lots of outside resources. We also have a U of M Roz Health Center in our building that we refer out to often. We love the partnership that we have with them. And they are very strong advocates for us as well. So we do love that. But what we have started to see because of the caseloads in our state is that many schools, very well-intentioned, are creating positions instead of hiring counselors because, yes, we know there's a work shortage. There's not a lot of us. So we're having districts create college and career coaches. We're having them create behavioral interventionists that don't have the training that we have. We go through our graduate programs alongside school social workers, alongside school psychologists. We're getting the same diagnosis training. We're getting the same group counseling training. we're not just going there to figure out how to get you to the right college. We're not trying to figure out how to get you to the right job. We are there learning the mental health side of it as well as academics and everything else. And the SMART bill can help with that. I know you brought that up. Looking at the college programs that are out there and getting interns into the field so that then they can go straight into the workforce. But another thing that is always kind of hanging over there too is we do have a lot of colleagues leaving the profession because they're able to go into private practice, or that our requirements for professional development just can't be met. They're too hard. So we are needed. We do have more training than those other very well-intentioned positions. School districts are trying to do what's best for their students, but that needs to be placing the right people in front of them.
Kind of along those lines of school counselors leaving the profession, we are finding that a lot of school counselors, because of these unmanageable ratios, are just feeling really burnt out. I wanted to speak to this because it's something that I'm currently experiencing. And I think I thought that maybe like, oh, well, this is just me in my situation. And then as we've talked to more and more school counselors around the state, finding that most people are really feeling the same way and for the same reasons. And so when you have so much on your plate that you are leaving the day not getting things done, and it's not just like a to-do list, it's student needs that aren't getting done, that really, that sticks with you. And so that creates additional stress. When you try and implement different changes, well, you know, if we had this kind of programming for the students, we would start to feel more control, or we could do these kinds of things in the school, and then this would change. And so even if you have the time to make the planning, when you have these ratios where you have 400 students, 500 students, you're not going to have the time to actually implement those things and see any change. So when it's really kind of killing optimism for school counselors as they look to the future. So when you combine those things with the pieces that like we already knew were part of the job, getting into it, where it's high stress, we're always on the go, that is going to lead to burnout. And we've already seen school counselors leaving the profession. We're going to see more if we don't make a change. And people that stay, we're finding aren't working at their highest capacity. And that's just, it's not benefiting the students in the long run.
So we wanted to kind of end our time with you on like, what would an ideal day look like then? If we could have 250 on our caseload, you've seen kind of what typical, even though there is no typical day, looks like with 300, 400, 500. If we had a lower caseload, we could have more dedicated time for student check-ins for each one of those, creating that connection. I know that Representative Brayback alluded to that contact point where they know you're the person. And that could be on a routine basis, not just once a year, if we're lucky. We could also have what are called minute meetings, where we're able to meet with everybody on our caseload and ask them very pointed questions to get to know them, get to work on a plan with them, get to really figure out more about them. We could have more data-informed lessons in the classroom, looking at what needs our actual district has at that point, and work on classroom lessons that fit that data. Whether that's things that are, coping strategies or peer relationships at the middle school level. It could be academic skills, it could be study strategies, it could be organizational skills, all of those types of things. And that would be meeting the needs of all of our students. We could also look at more data-informed small groups where we have, 8 to 10 students working on more intensive interventions. We do run those when we have the time in our school for grief groups. We've done it with students that have mild to moderate anxiety or depression. But we don't have time to run those a lot of the times. We could also have more parent meetings. We could have more parent education. We could have more parent webinars. We could do more parent outreach. And we might even be able to have a lunch and a bathroom break during the day, because a lot of days we don't have those things. So even though Michigan is right now third worst in the country, you have a golden opportunity to become a shining light in the country and move up to that number one position, or at least very close, by looking at ways to make this possible for your school counselors that are on, as you've said, kind of the front line in the buildings.
Thank you both so much. I really appreciate you being here. Colleagues, will open it up for questions. Rep. Thompson. Oh, we're good? Okay. Rep. Schmaltz.
Thank you, Madam Chair, and thank you for being here. And I appreciate, I talk to our school counselors all the time, and what you do is so admirable, and thank you for being there for our kids. You did mention some solutions about shortages. Maybe it would be a good idea if we got together with you and some other counselors so we could really work on this issue, because we do want to make sure every child is taken care of, but we have such a shortage, and our ratios are bad. So maybe if we sat down with a bunch of you and came up with more solutions to kind of, rectify that. Thank you.
We'd be very open to that.
Rep. St. Germain.
Thank you, and thank you for being here. Does all the counselors that are employed now, do they all have to have a teacher certificate? I'm just curious.
No, I actually don't have a teaching certificate.
I didn't know.
And
Yeah.
so there's a few different ways actually to become certified. If you don't have a teaching certificate, for everyone, it's a 2-year master's program, although we're working on some accelerated programming as well to kind of help with the shortage. But that was traditionally, that is, you just have a 2-year master's and then you have a counseling degree and then a school counselor license.
Okay, I didn't know. Thank you.
Yep, and all of your programs, all of your graduate programs, hopefully, are following the same accreditation. So no matter what program you're in, you're getting the same training. And then we still take the MTTC test for school licensure.
Okay, thank you.
Colleagues, any more questions for Rebecca or Sam? Thank you so much for being here. Thank you for taking a break from your students to be able to be here in front of us, hearing this very important testimony. We really appreciate it. Thank you.
Thank you, guys.
Thank you. So now I'd like to call up our former colleague and rep, Dr. Cheryl Kennedy, who is also the legislative liaison for Michigan Department of Education, and obviously wishes to speak and opposes the bill as written. Welcome, Dr. Kennedy.
Thank you so much, and I will be brief. And I just want to say, counselors, thank you so much for all you do. There were a few things I thought of that weren't on your list of things that you do during the day. As a former administrator, I know that my school counselors were also available for staff and for even their administrators when we were having a really bad day. So thank you for all you do. And I don't want our card of opposition at this time to be misconstrued as not supporting this very aspirational bill. We believe that the ratio between students and counselors is very impactful and needs to be addressed. Our concern is only that this is a policy bill, and what we're talking about would be considered, we think, would be considered an unfunded mandate to the tune of, if this ratio were across the state, it would cost $512 million to make sure that we are funding this ratio. Now, there are a number of schools that are already doing this, right? So that doesn't take that into account, but it is significant, and it's an investment. And so we just want to make sure that that we understand that this is a policy bill and that there is a cost that goes along with that. I would like to bring up, however, that in 2022, 340 of our 800-some districts in the state of Michigan did not even have one school counselor. And so if we addressed even that 340 districts that did not have even one school counselor, that would bring that cost down to $31 million. So I'm just bringing forward information to the committee to say we've got a lot of work and space to move forward in this place, and that we just need to be mindful of, as Rep. Schmaltz is saying, we do have a pipeline issue, but we are also working really hard on that, right? So we expect in 4 to 5 years that we'll have less of a pipeline issue, in the same way we've grown in our teacher preparation capacity significantly this year by 30% over previous years. So we know we're making good movement in that area. But that takes time. It took us time to get into this hole that we're in because of lack of investment. It's going to take us time to now rebuild a pipeline to get those professionals. We do not want to cannibalize from our community resources. Our communities need those resources too. So I just wanted to bring those issues formally so that it was very clear that we do not oppose the intent of the bill, the aspirations of the bill. We just have to speak up when there is a concern about funding and capacity. Thank you very much.
Dr. Kenny, one moment. Rep. Glanville.
Yes, thank you. Thank you, Dr. Kennedy, for the information that you already shared. I'm wondering, and perhaps this has already been shared with some of the bill sponsor, but do we have data, or what data do we have around school counselors? I really appreciate that you mentioned there are these 340 districts that just don't. Do we know specifically which districts already do? I know, Rep. Braybeck, you mentioned that one district was surprised. Oh, we already. So, can we get some information around this and maybe better understand exactly what the target is and how we might be able to approach that rather than, again, it's a very aspirational bill, and I appreciate that, but I feel like we need to, if we can dial that in a little bit, if there's any reporting.
I believe the only reporting we have is if a district has school counselors. Having said that, I will go to the experts in our department, be happy to get back to you and to the committee with the answer to that question.
Thank you so much.
Colleagues, any other questions for Dr. Kennedy? Thank you so much for being here.
Thank you
today.
so
We
much for the
appreciate
work
that.
you're doing.
Absolutely. Colleagues, again, this bill is intended to get the conversation going. I do think it's important that we do better in this area. We are doing terribly right now as a state, and we are letting our students and kids down by having our ratios be so egregiously misaligned. And so I am grateful to those of you who said you want to work on this and try and figure out solutions and work with our partners on this to move the needle on this issue. We know that funding is an issue. I continue to look, like I've mentioned before, at the Colorado program. I think it's a good model for us to look at in the research that I've done on it. But I would welcome any of you who want to join me in trying to continue to, like I said, move the needle on this. And I thank you for all being here today and listening to this important testimony. I feel it's so vital, again, for our young people that we address this issue. So thank you. All right, we have no absent members. And so that is us for today. So there being no further business before the committee, this committee stands adjourned. Thanks, everybody.